The topic is, what is an infectious disease specialist? An infectious disease specialist is a medical doctor or a physician who specializes in infectious diseases. Infectious disease doctors are healthcare providers who specialize in diagnosing and treating conditions caused by bacteria, viruses, parasites, and prions, and fungi. Infectious diseases are illnesses caused by harmful organisms that get into your body. These organisms are everywhere. Most of the time, we coexist with them without ever causing any problems. But they can also cause disease that range from mild to deadly. Infectious disease can be spread from person to person through contaminated food, water, and soil, through insect or animal bites, sexually, airborne, and other. Infectious disease can affect any organ of your body. For example, skin, urinary tract, lungs, bone, heart. Infectious diseases are very common around the world. Some of them are more common, for example, influenza, COVID-19, salmonella. An infectious disease doctor is a specialist that is an expert in diagnosing, managing, and treating rare, complex, serious, acute, or chronic infections. They often work with other physicians and specialists to diagnose and treat conditions and determine the cause of a specific symptom. They may spend hours conducting research how organisms affect different parts of the person's body and how those organisms affect society as a whole. They can also work on new and emerging infectious disease or infections that may change over time, infections that may spread through international travel, antibiotics, antivirals, and vaccinations. Some of the infections that infectious disease doctors treat include diagnosing rare or complex infections or viruses, identifying an organism causing a person's symptoms, making interpretations of laboratory results, treating an infection due to antibiotic resistance, pinpointing reasons for symptoms like unexplained high fevers or high white blood cell counts, providing long-term specialized care for chronic infections such as HIV/AIDS, hepatitis, consulting on guidelines for antibiotics and vaccines, and deciding types of disinfectants, protective equipment that may be needed to minimize infections in the healthcare setting. Some examples of infections treated by a specialist include Clostridium difficile, E. coli, fever, hepatitis, HIV/AIDS, high white blood cell count or leukocytosis, Lyme disease or other tick-borne diseases, measles, meningococcal disease, mpox, mumps, rubella, sexually transmitted infections, streptococcal infections, tuberculosis, whooping cough, COVID-19, urinary tract infections, MRSA, skin infections, osteomyelitis or bone infections, septic arthritis or infected joints, Helicobacter pylori, shingles, herpes. Infectious disease doctors have similar backgrounds as other doctors. They spend additional years understanding and learning about infections and immunology and epidemiology. It requires years of training to include an undergraduate degree, medical school, which is 4 years, a residency in internal medicine, which is 3 years, a fellowship in infectious diseases, which is 2 to 3 years, and subspecialization in certain areas, for example, HIV medicine or transplant medicine. Board certification. Well, thank you. Join my social media pages for more health education.